We're proud to host Project Pink for a 9th year. The Project Pink bus travels across the greater Charlotte area to provide free mammogram screenings for women who don't have health insurance.
And today it's been parked in the WBTV visitor lot. Now, Caroline Hicks has been out there all day long, and she's joining us now live with an update. Caroline?
That's right, John and Siobhan. So the bus actually just left a short time ago, but 27 women were able to sign up for those appointments ahead of time to get those free mammogram screenings. This is for women 40 and older who do not have health insurance. So this is a really great way to remove some of the barriers that they may face when it comes to getting a mammogram screening. And I'm joined this afternoon by Dr. Neelam Desai with Atrium Health Levine Cancer, who works with Project Pink. Tell us a little bit more about why this project was started in the first place.
So Project Pink is a partnership that started almost 15 years ago between Atrium Health Levine Cancer Institute and Charlotte Radiology. And the idea is that we know breast cancer is extremely common in women, and unfortunately some of our underinsured or uninsured women are not able to get this potentially life-saving screening mammogram. So with this partnership, they're able to provide free mammogram screenings for these patients.
It's so important. And I know that even if a woman is diagnosed, the care doesn't stop there. They are there, the team at Project Pink, to help them through the process. Talk a little bit about that, what happens after a potential diagnosis.
Absolutely. So, of course, that's just the beginning of the journey. With partnership with Atrium Health, where these women get partnered with a navigator to begin with that's associated with our breast care clinic, and they help coordinate everything. So they need additional workup. They need consultations with different providers. We have to understand how advanced the cancer is and come up with treatment accordingly. So they help with all of that.
Absolutely. And we also know that this project is funded by community donations. So how important is it for people at home to, consider donating to a cause like this?
Absolutely. It's a life-saving donation, truly. So $250 donation will allow women to get a free screening mammogram. And so that is, these women, they are part of our community, mothers, sisters, daughters, and the impact that breast cancer has is not just on them, but the entire family. So it's very important.
And we were talking a little bit about risk factors. I know there are so many, but you've said that even younger people are now being diagnosed.
Yeah, so we are seeing increasing incidence in younger women, although I will say that the overall incidence is still low, and breast cancer typically is still diagnosed as women get older. But, we do not fully understand the reasons why. There's some thought as to lifestyle factors maybe playing a role. So sedentary lifestyle, being overweight or obese affects your risk. High intake of alcohol or a diet that's high in fat and low in fruits and vegetables. But increasingly, it's important for women to be aware of their own risk factors, such as family history. So if you have strong family history of breast or ovarian cancer, even if someone had genetic testing and they tested negative, that is still important to know. Women who have children at a later age, over the age of 30, who start their menarche younger, have menopause later, all these things add up as risk factors. So it's important to be aware of these risk factors.
Yeah, so many of them. And it's why a project like this is so critical, to make sure that women who do not have health insurance are still able to get access to that early detection. We have more information on our website, WBTV.com, if you'd like to sign up for a future appointment with Project Pink. Back to you.
All right, Caroline, sounds good, and important to be your own health advocate out there. Thank you so much.